Hey guys, it's Noah from JNM podcast. I'm here with my friend Jarrell and my friend Micah. I'm the host for today, and we're going to be talking about healthcare inequities and inequalities in the healthcare system in America. So let's get this started, guys.
Let's get the ball rolling.
Yeah, let's get the ball rolling.
Okay, number one.
Well, I think we should talk about kind of like the history and just the background of how Black people were treated just in the healthcare industry in the first place.
Yeah.
So like originally, they were treated as like basically like people that experiment on medically, like the was it the Tulsa like experiments? Was that what it was? Like where they gave them like syphilis and
Yeah, I know what you're talking about. Like where they trialed syphilis and then it's still prevalent in people today. Like
Yeah.
and that's like a big reason why a lot of people like distrust the healthcare system.
it also
like, the Black
goes
community.
it goes back further to like when they like the stereotypes were that Black people are more tolerant to pain, which isn't true.
Yeah.
And like they feel like this, they feel less pain than other people, which isn't.
I think that idea was kind of pioneered by Marion Sims, who is the quote-unquote father of gynecology.
Yeah, that's.
And he experimented on Black women and Black babies and did like a lot of like horrific things and used like a lot of like inhumane tools on them. And then to reason with his practices, he claimed that they had like a higher pain tolerance or didn't feel pain the same way that white people do. And he killed like a lot of people, including babies, children, and women.
Also, yeah.
Also, a lot of black people have been treated very unfairly. A lot of modern medicine is actually based off the experimentation of Black people, and a lot of pseudoscience used to further propagate those stereotypes, like Black people are a certain way. They would use certain terms. They would pick apart Black people's brains and say their cerebellum, because their cerebellum was larger. It means they couldn't further comprehend anything. They use stuff like that. So
yeah, there's also the idea that they're closer to animals, that they're less human, that, like you said, they're feeble-minded, and just a lot of stuff like that.
Yeah, and you can. And if you use that to think, if you use that to think about back in the day, like due to racism, they just wouldn't get the same treatment. They would get worse treatment, or they would get no treatment at all from doctors or hospitals and stuff like that, or they just wouldn't be able to afford treatment.
Because they're like segregated, not even like proper hospitals in their community, and I think that's what we want to lead into with the next thing, because this is you say back in the day, but this is a modern study, talking about how Black adults attribute health inequities to less access to quality care and other reasons. So it's kind of broken down into whether each reason is a major reason, minor reason, or not a reason at all for why they think their healthcare access is inadequate. So 63% of Black adults think that less access to quality medical care where they live is a major reason for why they don't get proper access. 52% think that they live in communities with more environmental problems, which kind of goes back to environmental racism and the idea that we kind of like push these people to the side into like areas that are not kind of desirable and maybe have like more pollution, more waste, more factories, more industry, stuff like that. 51% of Black adults think that they're more likely to have pre-existing health conditions for whatever reason. And then I don't know if you want to take the rest, Noah. You hear down?
Oh, yeah. 47% think they're more likely to work in jobs with they'll risk health problems for them. and 47% believe that most hospitals and medical centers give lower priority, which is already a historical fact at this point about how hospitals and the medical care and the medical pharmaceutical industry treats black people.
So yeah, it's important to note there that 47% think that that is a major reason, and 30% still think it's a minor reason. So that's a vast majority think that they are being given lower priority to care.
Yeah.
So yeah, I think like this is important because it shows it's not just like, back in the day. It's like a lot of people are still getting inadequate access to medical care that they need, life-saving treatment, which is like obviously leads to more deaths and more like illness and just higher cost of living due to medical issues.
And also just like even like for everyone, like a lot of people just don't go to the hospital. They just because of the cost of stuff. Like a lot of people don't have insurance and stuff. They can't pay the medical bills. So a lot of people, if they get injured or something, they just don't go to the hospital in general. They just try and help self-heal, which could has like if it's a serious injury, could have like permanent effects on your body that could affect you.
Yeah, definitely.
It's also working conditions. Like a lot of minorities take a lot more dangerous jobs like construction, like trades. They do have a lot of payoff and money, but a lot of them are pretty dangerous, like electricians and stuff like that.
Yeah, plumbing. You're exposed to a lot of disgusting things in this pipes.
A lot of maybe like factory jobs as well. Jobs in agriculture where you're exposed to the elements, stuff like that.
Yeah, jobs. We live near the Motor City.
Yeah, my grandfather used to work at like a Ford car making plant thing.
Yeah, I'm pretty sure some of the plants were like they bulldozed neighborhoods to build those plants.
Yeah, and also like the workers had to they had to protest to actually get like fair wages and shit. Like
Yeah. Actually, I think my grandfather worked at a plant too.
yeah, he worked at my grandfather. He worked at like a Ford car making plant, and it's like
There's a lot of exploitation of people of color through these companies and plants, and put them in situations and give them jobs which greatly risk their health. So
Yeah, and I think a good takeaway is that the healthcare system in America is already pretty messed up and pretty just bad for anyone who doesn't have a lot of money, and then add the racial inequity on top of that, and it leads to pretty bad health outcomes for people of color.
Yeah. All right, now hit it. Go
Yeah,
ahead and
just
do
wrap
the
this up here.
Okay. Bye, guys. Have a great day. Make sure to subscribe, hit that like button, and maybe if we have a bell notification. I don't really know that. I haven't looked at the YouTube channel too much. Jarrell's the real player. He's the real one doing it behind the scenes. Maybe Micah. I don't really like him too much. I'm just joking. All right, guys. Have a great one. Goodbye.